Hello and welcome. You're watching Business Today Television. I'm Sakshi Batra, and in this very special conversation, I'm joined by a very, very special person. Ms. Preeta Reddy joins in, the Executive Vice Chairperson of Apollo Hospitals. Welcome, ma'am, and thank you so much for speaking to us on Business Today.
Thank you. It's a pleasure being here. And Business Today, I was just asking Mr. Puri, you've been in this business for 50 years, and to keep reinventing, sustain is incredible. We are 40 years old and we're going to learn from you all.
Wonderful, ma'am. But, of course, corporate excellence is what we are rewarding today. I want to understand from you, what are the three tenets of leadership skills that really help you achieve through all the ups and downs, through global uncertainties? What has really helped you? And, of course, if you could give that as a guiding message for all the young and budding leaders.
I think it's actually simple that when we're in a business like we are, which is in the business of caring, it's the focus which matters. And at the end of the day, whatever we do it for the patients, for their families, and for those who trust us. And with that, it's a great responsibility and it's a huge commitment. So consistently, we're focusing on bringing the best in class technology to our country. We did it with cancer at the Proton Center recently. And yesterday, we launched for the first time in Southeast Asia the ZAP machine, which is the fastest and the quickest way for radiation for brain tumors, totally dedicated for brain tumors. We're doing this because we know that, India needs such technology, and while it could be challenging, I think at the cost which we are able to provide healthcare to our countrymen, which is 1/10 of global costs, I think we've got a great product. I also think that the world is looking at India now for solutions, even the so-called developed countries, and we've come a long way. And Bharat, India truly, truly matters now, and we've got a large population which needs to be served.
Absolutely. Ma'am, the other factor a lot of, viewers out there would love to know from you is how soon are we progressing towards more and more affordable healthcare in India? Is that going to be a top of the radar question for a whole host of, entrepreneurs, for business people like you at this point in time who are in this business?
I think value-based healthcare is extremely important. The question of affordability is, how do we really fund and finance it? And I think we have to be innovative. Number one, with our products, can we value engineer? Can we bring out med tech? Can we, pharma is doing amazingly. We are the pharmacy of the world. Can we find out the cost of, the largest and the hardest cost is the cost of infrastructure. Is there, smarter ways to really fund infrastructure? I think that needs to be done. We do have a manpower challenge, and there is a cost to high quality manpower. So can we find better ways to do that? So by and large, I think a lot of value engineering to be able to, without compromising on quality, try and make it as affordable as possible is what we need to do. It's a responsibility for every healthcare provider. I also want to flag one thing, that when we started, the cost of a bypass surgery was 1.5 lakhs to 2 lakhs. 40 years later, it's still the same, despite inflation, despite whatever happens. So I think India's been able to do that. And healthcare providers have really embraced the fact that, we need to do the highest standards and quality at the best costs, and we're doing that.
That's wonderful, ma'am. Everybody talks about how this is India's moment, how it is going to be India's decade. What is the kind of growth that you see for the healthcare industry at large over the next decade, ma'am?
I think healthcare as an industry is growing in the double digits. Simply because there isn't enough, there is a scarcity. And even if we add on 100,000 plus beds every year, it will still continue to grow at 12 to 13% for the next 10 to 15 years. So I think there's a lot to be done. But the allied health, health industry, and I think that's where we have to focus and look at growth, research, the use of Gen AI. How much can we really be the knowledge base for the rest of the world in the skilling, and how can the lack of skilled manpower be replaced by innovation and technology? We have to think of that. Can we, again, as I said, develop medtech products? India imports 80% of our medtech products are imported. So can we do that? So I think from a healthcare space, there's a whole ecosystem which is growing, and not to forget the fact that the largest number of startups today are in the healthcare space. None of us realize that, but they're small, they're large, but they're doing amazing work.
Absolutely. Do you think that digital innovation has really helped, close a lot of gap between the healthcare seekers and the healthcare providers? And where do we go forward from here? How are technological advancements like Gen AI, like you pointed out, are going to help bridge that gap?
So we started Apollo 24/7, which is our digital foray, and that really provides doctors 24/7, anytime a doctor's opinion in the remotest locations. 19,000 pin codes is what they've told me just recently. And then drugs are delivered at people's doorsteps again. So I think these two things have happened. But what is developing is that the utilization of the data, which, this exercise is churning out to see, can we predict the onset of disease? Can we find pockets where intervention is required? Can we really educate people on healthy lifestyle so that they don't have to get into hospitals? So there's a lot which is like a spin-off of digitization, and I think India will literally leapfrog into the future by adopting all this.
Absolutely. You mentioned it correctly. And on that point, I just wanted to ask, these days everybody is getting, doorstep delivery as the hang of it. They've got so used to of getting groceries at home within 10 minutes. How soon are we going to see this in a larger impact for the pharma, deliveries as well? Of course, a large part of OTC, products can actually be delivered within 7 to 8 minutes of need. Is that something that you have on top of your mind? Is that the need of the hour?
I think we're trying, but it's definitely not 7 to 8 minutes. And then prescription drugs have to be handled ethically, that, the doctors have to clear, there has to be a prescription. So I wish it was as simple as groceries, but I think some of the OTC products will start, reaching people much quicker and much faster. But the good thing is that opinions will reach them fast. Early interventions in an emergency, where you need to intervene, to tell them to go to the hospital or to tell them not to worry, either which way. And I think that is game changing. And the more we do it, the more we'll realize that people don't have to trek to hospitals unnecessarily.
That's wonderful. Well, many thanks for speaking to us. It's always a pleasure to get such enlightening words from you, which really benefit a large part of our viewers, ma'am. Thank you.
Thank you. It is a pleasure being here with all of you. And thank you for the award.
Congratulations.
Thank you.
Well deserved, ma'am. We always say that.
Thank you. Thank you so much. Thank you.